January is Cervical Health Awareness Month, and we thought it was really important to kind of talk about what that actually means and what's sort of behind that. I'm Dr. Jim Heiss, Chief Medical Officer here at Door County Medical Center, and joining me today, I'm really thrilled to have Dr. Beth Gaida, who's an obstetrician gynecologist here at Door County Medical Center. So the first thing is we've all heard of Pap tests. I'm sure we all like them very much. And what's interesting is, I just learned this actually, that Pap is short for a name, Dr. Papanicolaou. So it's actually a Papanicolaou smear. But Dr. Gaida has actually a really great story related to that.
Yeah, thanks for having me, Jim. So January is Cervical Cancer Awareness Month, and it brings to attention a disease that's often not ignored, but just not in the news as much as some other GYN cancers. So worldwide, actually, cervical cancer is largely a disease of the developing world. So women that do not have access to Pap testing, to pelvic exams and cervical cancer screening. And so how this all started, is back, I believe, in the 1960s, 1950s. Dr. Papanicolaou was an obstetrician gynecologist, and he actually performed a pelvic exam on his wife every single day, and got samples for what is now called a Pap smear. So did a cervical smear every day for 20 years on his wife in their kitchen, I'm assuming. So over the decades of that, he got more information about how cervical cells change throughout a menstrual cycle and throughout a woman's life and reproductive history. And so I always say we actually have to thank Mrs. Dr. Papanicolaou for allowing herself to be a test subject and get a pelvic exam every single day for 20 years. And so it used to be the Pap smear. So about 20 to 30 years ago, it was, you go to the gynecologist every year and get a sample from the cervix, and then they would smear it on a slide for a microscope and then use the hairspray to fix it, and then they would look at it under the microscope. So technology has really changed and improved over the years. So now we call it a Pap test because we're no longer doing a smear. So now you'll see we put the sample in a bottle of liquid that's called liquid-based cytology, and so they actually can get more cells from the brush that we get the sample from and run it through a computer, and the computer can kind of condense the cells, and there's a special technician in the lab called a cytotechnologist who largely what they do is look at Pap samples every day. In addition to that, the liquid-based technology allows us to do DNA testing on the sample, and we're specifically looking at the human papillomavirus, or the HPV virus, and that's what causes about 95% of all cervix cancers. So when you come to us and we do a Pap test, it's actually a 2 tests in 1. We do the Pap test, and for women over age 30, we're doing separate HPV testing. So that's when you get the results, you'll see both of those combined. So it's a lot different than what Dr. Papanicolaou was doing in the 1950s. And so that's where some of the changes in the timing and how frequently you get Pap testing now, the frequency has changed just because the technology has changed and improved.
Now tell us about, we know that HPV is human papillomavirus, but why do we test for that? Why is it important, and how does that play into the whole idea of cervical cancer?
Sure. So there's over 100 species, different strains of the human papillomavirus. The HPV can cause plantar warts on your feet, cause warts on your hands. It can cause polyps and actually some cancers of the esophagus and the head and neck cancers. And HPV specifically causes about 95 to 98% of cervix cancers. It's also largely responsible for the majority of anal cancers and vulvar cancers, and some penile cancers, although that's quite rare. So HPV is around everywhere. So if you have had intimate sexual contact with someone in your history, you've been exposed to specifically the genital HPV strains. Again, everyone has been exposed to the strains of HPV that cause plantar warts on your feet, on your hands. So again, it's around, it's everywhere. It's just specifically when we're doing the Pap test now, we're specifically concerned about there's about 9 different strains that they're looking for that cause the majority of cervix cancer. So we do believe that cervix cancer, and again, vaginal cancer and vulvar cancer, are largely viral infections. And so we do have a vaccine to prevent that virus.
And so there's always a lot of questions about the vaccine. Is it, and I think you've already explained why it's important, because it is so prevalent and because it's not just an infection that you're perhaps trying to get rid of, it's also trying to prevent cancer. But tell me, so depending on someone's HPV result, does it change how often they have to get a Pap test?
Correct. So in general, in the United States, it's recommended regardless of your Gardasil vaccine status or if you've had sexual contact or not. So we do recommend starting Pap screening or starting screening for cervical cancer at age 21. And between ages 21 and 30, we recommend Pap testing every 3 years. So we like to see people every year just to talk about their general, kind of pelvic health and do an exam, but we only test for cervix cancer every 3 years as long as all that testing is normal. Starting at age 30, we actually do the Pap and HPV, and that's called co-testing when they're together. And we do that every 3 to 5 years from ages 30 to 65. And again, assuming in low-risk women that have no abnormal Pap testing, we actually stop screening for cervix cancer around age 65, just because if you have not caught the HPV strains that cause the precancerous changes to your cervix at 65, you're probably not gonna, it's probably not gonna be virulent enough to cause cancer. So those are low-risk women. So starting at age 21, Pap testing between ages 21 to 30 every 3 years, and then from 30 to 65, Pap and HPV co-testing every 3 to 5 years. Now, if there are abnormal cells found on the Pap testing, or if there are some of the high-risk HPV strains identified on that HPV testing, that changes the frequency of cervical cancer screening and Pap testing. And we use an algorithm actually put out by one of the kind of academic groups in the United States. It's called the ASCCP, or the American Society of Cervical Cytology and Pathology, and they put out all the recommendations and guidelines and how to follow abnormal testing. And I always say, my patients, if you come to see me, you'll get I have the app on my phone, and I will put your information and your testing results, and then we follow what that algorithm tells us.
Well, that's a lot of great information. So just want to thank Dr. Gaida for joining us today. I want to thank you for joining me.
Thanks for having me.
Thank you so much. For more information on this, be sure and check out our website at dcmedical.org and check out the DCMC blog. You'll find information about Cervical Cancer Awareness Month, Cervical Health Awareness Month. So thank you so much for joining us. We'll talk again soon.